Hello, everyone. My name is Celestina Amlalo, and I will be presenting on my scholarly project, the care coordination model in the treatment of women diagnosed with substance use disorder. My committee members are my chairperson was Dr. Ashton Lindsay, my second reader was Dr. Marie Snare, and then my committee member was Catherine Cordell. Background. The rate of substance use among women is increasing. In the same way, there is a challenge in the quality of care delivered to women diagnosed with substance use disorder. According to Carriage et al., women are likely to develop substance use disorder between the ages of 18 to 29 years of old. During these years, they are sexually active. This means there is a high chance that pregnancy might occur among this population. The most appropriate intervention for this vulnerable population in the facility was the implementation of the Agency for Healthcare and Quality model. The model involves deliberate information sharing and care organization with relevant care professionals. This study was guided by a Picot question among pregnant women ages 18 to 35 years old undergoing treatment for substance use disorder. Does the implementation of the care coordination model for the Agency for Healthcare and Quality Research Framework approach in comparison to a different disciplinary approach reduce the adverse health effects within 8 weeks? The significance behind this project. The study aimed to examine the effectiveness of the multiple professional care coordination model in improving the quality of care delivered to pregnant women with substance use in terms of referrals, according to an article published in 2022 by Healthcare Tech Outlook. Although referrals are essential in improving patient care outcome and reduces revenue leakage, 65% of referrals are necessary. It was hence vital to make the patient receive the necessary care within the healthcare facility without unnecessary referrals outside the facility. The literature review behind this: substance use and pregnancy. Substance use and pregnancy among mothers has been on the rise. Han et al. 2017 defined substance use as the utilization of alcohol, drugs, and inhalants, misuse of prescribed drugs, cigarettes, and illegal drugs, among other substances. Research has shown that misuse of prescriptions, the use of illicit drugs, alcohol consumption, and tobacco smoking during pregnancy have several health impacts on both the mother and the infant. The substances easily penetrate through the placenta and reaches the fetus. Taking of illegal drugs, including heroin and marijuana, exposes the mother to a high risk of stillbirth. This position is maintained by Joshi et al. 2021. The author argues that the use of opium among pregnant mothers has reached a significant high level. Among 1,000 births and deliveries recorded in the US hospital, 1.5 to 6.5 cases of opioid use disorders are diagnosed. According to Joshi et al., women diagnosed with disorders have a high probability of developing disturbing neonatal and maternal health outcomes. Substance use and mental health. Substance use among pregnant women is associated with poor mental health. An article that argues that women who engage in drugs are prone to potential health disorders, especially mental health, including stressors and including depression. The nature of these conditions has contributed to the increased maternal morbidity in this country. According to John McConnell et al., the level of maternal health and mental health experienced by mother can be transferred to the child when these cases are handled without due diligence. The current model of treating substance use and drug addiction involves the separation of the child from the mother. This kind of mother-child separation can negatively affect the child's development and the mental health. The children are exposed to risks of developing depression, and potential involvement in drug abuse. Some healthcare facilities have also developed approaches based on the single professional intervention. Dedicated professionals such as counselors and physicians are given the responsibilities of delivering care services to substance use patients. This approach has not been effective in handling substance use among pregnant mothers. There is a need to develop a proactive solution in this challenge. The literature review continues with this care coordination model. As we were using the Agency for Healthcare Research and Quality model approach and care coordination as an appropriate model tool in the achievement of comprehensive substance use and mental health among pregnant mothers. According to Copeland et al., women who have been engaged in substance use are prone to stress and depression originating from the loss of their child custody, anxiety, and societal stigma. This kind of mental problem can make the mother incapable of caring for the child after recovering from the substance use disorder. This indicates that there is a need to incorporate a coordinated model that would not only assist the patient in recovery from the addiction but also help them reintegrate with society effectively. Medical therapy can improve the mother's health and save the child. However, it is not enough to maintain the mother's mental stability to care for the child. This indicates a need for a coordinated model that involves several professionals. The care coordination model is regarded as the most reliable and effective approach towards the treatment of substance use. Shepard et al. Informed that this model should involve professional nurses, social workers, psychologists, physicians, and other relevant paraprofessionals. These professionals are needed to coordinate their efforts towards the achievement of improved patient health. The involvement of physicians and doctors in the model has its significance in the treatment of this process. The theoretical framework behind this project. The framework in this project was compromised by two theories, namely the trans-theoretical model and Newman system model. The Newman system model was developed by Betty Newman with recognition of the necessary variables that should be considered when dealing with patients in a care system. The model indicates that clients should be viewed as a system. Whilst addressing stresses, there was the need to focus on spiritual, developmental, social-cultural, psychological, and physiological aspects. Within this model, the client can be a social entity, community, a group, family, or an individual. According to Ali Good and Marina Tomei, 2014, every client system is considered unique and it compromises of characteristics and factors that are within the response reach. The implementation of this model in the project required the involvement of professionals to focus on the five variables for effective delivery of care to the patient. Newman's model was useful in enhancing the implementation of care coordination approach. It promoted the perception that pregnant women engaged in substance use should be treated with a complete focus on the five variables. All of these variables were handled by different professionals in the care system. For instance, the psychological components can be managed by a psychiatrist or a psychologist, whilst the social cultural aspects are the responsibilities of the social worker. These diverse professionals need to emerge these efforts in ensuring quality care is delivered to the patient. Substance use disorder is a psychological condition, hence indicating the need for a psychological intervention. The pregnant women engaged in drugs might need medical treatment, which necessitates the availability of a physician. The nurses were required to the provision of care and ensuring the recovery of the patient. This makes the Newman system model an appropriate option in this project. The study design. The study used a quantitative research design. This design allowed for the collection and the analysis of study results in a statistical procedures. This method is appropriate for the project since it allowed for a comprehensive assessment of outcomes through a quantitative design. It was possible to understand the impact of multiple professional care coordination model on the rate of patient referrals. The sample. The project was conducted through the implementation of a care coordination model in the delivery of care services to pregnant mothers diagnosed with substance use disorder. The participants were recruited in the study using vigorous inclusion criteria. The participants must have been within 18 to 35 years range. They were diagnosed with substance use disorder by a certified health care professional. The participants must be pregnant during the project, be willing to undergo the entire treatment process, and the participants should be attending another treatment program before and during the program. The selected participants provided the signed consent forms after going through several lessons concerning the project. The lessons contained information regarding what the patients should do and their expected benefits as well as risk. After that, the trained professionals were introduced into the project as well. The patients underwent an assessment to determine their effective and prospective needs. The data collection and analysis. The data collection was collected using the electronic health records, the EHR, which provided details on the number of patients that have recovered from substance use disorder since the initiation of the project. The EHR was useful in providing information about the patient's referral outside the healthcare facility. The data in the project was analyzed using a quantitative method. The quantitative method was analyzed using statistical methods. For instance, the t-tests were used in analyzing referrals before and after the intervention. The referral data before the project was compared to the data after intervention for the purpose of determining the differences and the impact of the project. Methods of evaluation. After obtaining the approval from the IRB and the healthcare facility, the procedures for implementing the multiple professional care coordination model was initiated. The researchers was interested in collecting data on successful referral involving pregnant women dealing with substance use disorder. The treatment used an instrument to collect data in the study of the electronic care records. This is the healthcare records that the facility had been using for many years. A recording of patients' treatment as well as treatment procedures. This is a valid instrument to provide reliable data for the intervention. Ethical considerations in the study included the protection of the collected data. The data was stored in a password-protected computer housed in a locked office. The results. A comparative approach was adapted to examine the referral rate before and after the intervention. According to the chart, the rate of patient referral outside the facility was significantly high among pregnant women with substance use disorder before the intervention, a score of N53. This was significantly reduced upon incorporating a multiple professional care model to N14. The descriptive analysis of the data shows that the average referral rate outside the facility has significantly reduced. This indicates that the implemented intervention had a significant impact on how this particular population was treated. Analysis of the t-test. A paired t-test would apply to the data analysis if the sample had a normal distribution. A violation of the normality assumption would necessitate a non-parametric test. The kurtosis value for pre- and post-intervention data indicated abnormal distribution. After, it was minus 0.406, and then before was a minus 0.641. The skewness score showed that the data was highly skewed. The analysis showed that the data violated the normality assumption. A Wilcoxon signed rank test was adapted since the data was collected from the same population. The Wilcoxon signed rank test is a non-parametric statistical test used to compare two related samples or repeated measurement from the same population, as summarized in the data. The statistical difference between referral pre- and post interventions were found to be significant. This was reported in terms of the Z statistics. The analysis proved that referrals after interventions were significantly lower than before. That was shown as a Z minus 5.336 with a p-score of 0.001. Therefore, it is reasonable to conclude that the intervention reduced successful referral among pregnant women diagnosed with substance use disorder. Discussion. The study found out that the rate of external referral among pregnant women with substance use was significantly lower post-intervention than pre-intervention. This was mainly because of the implementation of the multiple professional care coordination targeting this patient population. These findings indicate that the intervention was successful in raising the effectiveness and the accessibility of support services for these patients with substance use disorder that are pregnant. These findings are consistent with the existing research evidence. According to Dan Porter et al., 2021, the care coordination model has been demonstrated to decrease the healthcare expenditures and improve patient outcome through quality care delivery. Albertson et al. 2020 discovered through a systematic review that care coordination models are linked to enhance patient satisfaction and improve care quality. The implementation of a multiple professional care coordination model in caring for pregnant women with substance use disorder led to the delivery of safe, effective, and a patient-focused care. The discussion continues again. Additionally, a study conducted that emphasizes on the efficacy of the care coordination model in managing the intricate requirements of pregnant women who also struggle with substance use disorder. Consequently, the infants and the mothers received superior prenatal care and were exposed to fewer risks. Particularly noteworthy is how this study impacted the healthcare and nursing practice. The study emphasizes the significance of care coordination across multiple disciplines when treating substance use disorder in pregnant women. The results underscore the importance of a multiple disciplinary team effort, including addiction specialists, physicians, nurses, and social workers. By coordinating care in this manner, pregnant women who are afflicted with substance use disorder are guaranteed comprehensive and integrated treatment that attends to their psychological and physical needs. The study limitation. The research has several limitations. Firstly, the results may not be as broadly applicable given the limited sample size. The only quantitative information used in the research to demonstrate the influence and the efficacy of the multiple professional care coordination was the referral rate before and after the intervention. This limits the study's capacity to provide a thorough grasp on how multiple professional care coordination influences the outcome of people with drug use disorder. Implications of the to nursing practice. The findings of this study has implications for the healthcare practice. The findings have confirmed that implementing a multiple professional care coordination model in care delivery can improve quality and care outcomes. This concept has improved communication and cooperation among healthcare providers, improving care coordination and fewer medical mistakes. The research also implies that this technique might increase patient satisfaction and the entire healthcare experience. The methodology enables the decrease of unneeded external referrals, saving the hospital money and allowing patients to get complete treatment. In conclusion, according to the findings of the research, multiple professionals care coordination may enhance the quality of care provided to pregnant women with substance use disorder. Multiple professional care coordination has been found to improve patient outcome, save healthcare expenditures, and increase treatment quality. Pregnant women with substance use may get comprehensive and integrated treatment that meets their needs, particularly with requirements and problems, by bringing together a varied team of healthcare providers. This collaborative approach ensures that all elements of their health are appropriately handled during their pregnancy journey, including physical, emotional, and social well being. It has also been shown that the care coordination strategy reduces external referral rates among pregnant women with substance use disorder. This decrease in external referral not only improves healthcare delivery efficiency, but also helps to minimize any interruptions in treatment that pregnant women with substance use disorder might encounter. The collaborative approach creates a friendly and a non judgmental atmosphere, which may assist in decreasing stigma and encouraging these women to participate in therapy. Here are my references, and thank you.